when English is a barrier to health and social care. A non-English speaker's experience. December 2022. Could you please introduce yourself? My name is Mr Lam. I live alone in a council house for older people. The biggest problem I face is the language barrier. I find it very difficult to communicate at the doctors and hospitals or deal with any repair issues with the council without someone to interpret for me. When services contact you, do they do so in a way that works for you? When I get a phone call from my doctor, hospital or the council, I don't know what they are saying to me. I say no English, but they continue to speak. Once, I vaguely figured out someone from the hospital asked me whether there was someone with me to help me. I live alone, so there is no one who can help me to communicate immediately. When I get a letter from the hospital, I have to wait for my friend to read it for me. If my friend is busy, it could take a couple of weeks before they can tell me what's in the letter. Sometimes, the hospital may need an answer for something, and time is running out. I don't know where I can get help to get the letter translated quicker. Last time, when the boiler in my flat broke down, I tried to contact the council. I said no English, and the person on the other end of the line just hung up. I couldn't have a shower for 2 weeks. Can you tell us your experience of making appointments at your GP practice and hospital? I once felt unwell and called into my doctors to make an appointment. I did not understand what the receptionist was telling me. I think she asked me to book an appointment online. I don't have Wi-Fi, don't know English, and don't know how to do it online. I left for surgery, felt helpless and almost burst into tears. I had to rely on my friend and wait for them to have free time to help to make an appointment. There is another time I got an email about my hospital appointment. My friends were too busy to help. I tried to respond but think I pressed the wrong button for cancellation. The hospital later called me but I couldn't explain. I have not managed to rearrange the appointment until now. What was your experience of using the ambulance and hospital wards after you had a car accident? When the ambulance came to take me to the hospital after a car accident, there were no interpreting facilities in the ambulance. I didn't understand what they asked me and what they injected in me. The area where I received the injection doesn't have any feeling now, but no one could explain to me why. I later woke up in a hospital ward. I couldn't get out of bed. I couldn't tell the nurse and staff that I was thirsty or needed someone to help me with toileting. I had to hold it in until the interpreter came the next day. The interpreter wrote down some simple phrases for me so I could communicate with the nurse and staff. What has your experience been like when using the interpreting services? I think the video interpreting for one of my operations in the hospital was great. The interpreter was professional, knew how to explain medical terms, and allowed time for me to ask questions. I sometimes have been allocated interpreters who I know outside of hospital. They don't always interpret all my questions. For example, I wanted to know the details about my operation, and they did not interpret all my questions, but picked and chose what they thought was relevant. I don't know who I can complain about the quality of translators to. What more could health and care services do to improve your experience? I think ideally, if the staff could speak my language, then I could communicate with them directly. That would be great. I know this is not always possible, so if interpreting can be arranged via phone at the point of access, that will be good too. I wish there was a department that could help to solve all my language problems. It could arrange professional interpreters before services called or saw me, and provide high-quality Chinese-English translation for my letters. Thanks to Mr Lam for sharing his experience. Produced by Healthwatch Leeds in collaboration with Ro Lara.